Okay, so our next presenter is Kristin Harrington. And Kristin is from the Epidemiology PhD program. And Kristin's presentation is entitled The Impact of COVID-19 National Lockdowns on Drug-Resistant Tuberculosis in KwaZulu-Natal, South Africa, a Spatial Analysis. Is the timer ready? Are the judges ready? Are we ready online? The timer will start when you begin.
I'd like you to think about the year that you had after the COVID-19 pandemic began. How many doctor or dentist appointments did you have to cancel? On the other hand, did you avoid getting the flu that year because of mitigation strategies like wearing a mask and social distancing? And did you know anyone, including yourself, who was unable to do things like social distance or isolate because of their job, because they took public transportation, or because they lived in a crowded household? These questions were meant to help you think about three concepts within the context of the COVID pandemic. Number one, healthcare disruptions. Number two, mitigation strategies. And number three, how both of these things may have impacted individuals differently based upon their education, their employment, or their living situation. My dissertation looked at these concepts and their impact on another respiratory disease, tuberculosis, or TB. Worldwide, TB has been a leading cause of mortality from an infectious disease for the past decade. And during the pandemic, TB, like almost everything else, was impacted by things like healthcare disruptions and mitigation strategies. There was likely a trade-off between the impact of interruptions to TB services versus masking and social distancing actually preventing airborne transmission of TB. We're really not quite sure whether or not the strategies put in place to prevent COVID helped to prevent TB as well, or inadvertently made it worse. To inform ongoing progress towards TB elimination, we need to better understand the impact of the pandemic on TB. For my dissertation, I used data from a cohort study of TB patients from the high-burden TB region of KwaZulu-Natal, South Africa. I also utilized data from the South African census to better understand municipality characteristics. I looked at the number and spatial distribution of TB cases before and after the COVID-19 national lockdowns, and also examined their individual and spatial characteristics. I'll share two important findings with you all. Number one, we observed an approximate 30% decrease in TB cases in the year and a half after the lockdowns compared to the year and a half before the lockdowns. And number two, the TB cases that we observed after the lockdowns were found in different regions than the TB cases from before the lockdowns, with 4 municipalities in particular that diagnosed significantly more TB cases after the lockdowns than before. These findings are important for a number of reasons. In order to not lose the progress we've made towards TB elimination, my results may help us to better understand the impact of COVID mitigation strategies on TB control in high burden settings. My research may also help us to identify areas at greater risk for TB, which may be useful in guiding active case finding methods and focusing activities on areas with localized community transmission. Thank you.